Many of us are focused on reopening to get small business owners back in their shops and, of course, earning money. But officials warn new health challenges should not be unexpected. Tonight, we here at Local 44 brought you a virtual town hall meeting about Vermont's response, featuring more than half a dozen guests, including Congressman Peter Welch and Vermont Health Commissioner Dr. Mark Levine. Local 44's Devin Bates now picks up our coverage.
We got a closer look at the current COVID-19 response efforts at both the federal and state levels, as well as an update on how businesses and schools are doing. Well over 2 months into the coronavirus pandemic, it's clear some concerns are still rising.
We have 40 million Americans who are without a job. We're approaching 40% of Vermonters who want to work but don't have a job.
Congressman Peter Welch said the payroll protection program isn't doing enough for businesses, adding that restaurants, for example, have to have their money spent by June 30th, when many restaurants may not even be open yet.
I co-sponsored legislation that addressed that problem, and small businesses would have until December 31st, and they'd have much more flexibility about how they would spend that money as to expenses like rent or utilities, as well as payroll.
Tom Torti is president of the Lake Champlain Regional Chamber of Commerce, and he said local businesses that are still shuttered look forward to reopening, but that alone won't be enough, nor is it sustainable.
They want to be here in order to be able to reopen. So the biggest fear is getting from today to some date uncertain in the future. And what we've been doing is impressing upon people that now is the time to patronize those businesses to the extent that you can.
And still, as discussions on reopening take the forefront, COVID-19 remains a public health priority. Referencing a recent outbreak in Winooski, Health Commissioner Dr. Mark Levine says this will likely be a wake-up call for many Vermonters that were not out of the woods yet.
The contact tracing is in progress, and the interviewing is all in progress. I can say, though, that it is a community outbreak, if you will, and it's not within a specific facility in the community.
Dr. Levine was also asked about the fact that in Vermont and across the country, African Americans have been disproportionately impacted by the coronavirus.
Very, very concerned about this. We know that there are historic reasons why African Americans may be at more risk of not only having a poor outcome perhaps, but of contracting the condition in the first place. And these go back to major issues of historical injustice, racism.
Others said inequity extends to education. Burlington School District Superintendent Yao Obang said a lot of effort has gone towards making sure students have the resources needed to learn in a COVID world.
We try to close that sort of gap in terms of providing all our students get a Chromebook or device they can access. And we also partner with community partners to ensure that students have connectivity issues.
Meanwhile, the University of Vermont and Champlain College announced on-campus testing for returning students. Officials had floated this idea at previous citywide updates on COVID-19. That begins next week. In Burlington, Devin Bates, Local 44 News.